to the pandemic, suicide rates were increasing. But COVID-19 brought along a wave of mental health problems, including rising levels of depression, anxiety, isolation, and suicidal thoughts and attempts, particularly for young people. Suicide is the second leading cause of death among young people. Rates have increased more than 56% over the last 2 decades. More than half of healthcare professionals say they have more frequently treated patients with concerns about suicidal ideation since the onset of COVID-19 compared to before. In one way or another, COVID has affected everybody. And in particular, this has taken a toll on young people trying to navigate virtual school, the loss of in-person socialization with other students, and expressing more fears about the future. According to our new survey of healthcare professionals, Generation Z and Millennials are the 2 generations that have experienced the most significant short-term and long-term impact on their behavioral health due to the COVID-19 pandemic. Essential workers are more likely to report symptoms of anxiety or depressive disorder, starting or increasing substance use, and are having an increased number of suicidal thoughts during the pandemic. The pandemic has highlighted the importance of mental health to whole person health and shown how intertwined and interdependent they are. And now people are more attuned to the importance of mental health and bringing this up with their providers and realizing there's no shame in seeking help, but rather appreciating that it takes an act of courage and bravery. We are committed to leveraging the power of data science to predict health problems before they occur, and then create personalized, meaningful ways to engage consumers on their journeys to wellness. We gather certain data points from more than 100 different variables from our claims system and use that information to develop an algorithm to predict who may be more likely to try to do themselves harm. This data includes looking at behavioral health diagnoses, variables related to social determinants of health, and frequency and utilization of health care at different levels of care to give us a view into someone's whole health picture. Behavioral healthcare managers could then use that data to reach out to consumers and work with them and their doctors or clinicians to ensure they were getting the support they needed as they progressed through their journey to wellness. But now there's even more urgency to do this work. Because of our role in the healthcare system, we are at the center of data on health, which gives us a unique opportunity to make a positive difference in our consumers' lives. If we can see who is most at risk, connect the doctors and clinicians to the consumer, and take actions to reduce their risks, we can not only save emergency room visits and hospitalizations, we can also help save lives and grief for our families.